My wife, Barbara, who sits here, led an effort in the state to increase immunizations. We got rid of junk food in schools. We brought mandatory phys ed in.
Can you do national health care,
yes, you
universal
can. Here's
health
how
care
we do
without
it.
raising taxes?
Yes, this is how we do it. Number one, my plan is mandatory. You do have everybody sharing, the employer, the employee, you have the state and the federal government. Secondly, I believe that we can have a plan where if you are satisfied with your health care plan, you can keep it. No new bureaucracies. But in addition to that, you focus on prevention. You allow everybody to get the congressional plan that every member here has. You bring Medicare 55 and over. That's what you do.
Thank you, Governor. I promised Senator Dodd he could weigh in as well.
Well, listen, there's not a person in this audience or who's watching this program who wouldn't tell you that they've encountered the problems of the healthcare system in this country. It is shameful. We rank 42nd in infant mortality in the United States worldwide. We rank 45th in life expectancy. It is shameful that in the 21st century, we have 47 million of our fellow citizens without health care coverage. 9 million children, and the number's growing every single day. Look, as we've said here, there's basic agreement about universality here, dealing with information technology, preventive care, chronic illnesses. What's been missing in all of this is the ability to bring people together to get the job done. That's what I've done for 26 years. That's what you need to be able to do if you're going to get this. No one party is going to write this whole thing. It's going to take cooperation to get it done.
I'm going to move on to the next question.
Can I say just 15 seconds?
I'll let Senator Edwards, and then I'll let Congressman Kucinich. I got a specific question for Congressman Kucinich, but go ahead.
Okay, I'll be very quick. I think it is very important, though, to understand. I think Senator Obama was very honest just now. We have a threshold question about whether we're going to have truly universal care. The New Republic has estimated that his plan will leave about 15 million people uncovered. He says he will do something about that later. I believe unless we have a law requiring that every man, woman, and child in America be covered, we're going to have millions of people who aren't covered. Secondly, all the savings that Senator Clinton just talked about are in my plan and they're in Senator Obama's plan. And both of us have recognized that it's going to cost significant money, and we've talked about how we're going to pay for it.
Well, Senator Obama.
Well, since John referred to me, I agree with him on the second point, which is we've got these savings and we're still going to have to do a little bit more, partly because you've got to invest up front in, for example, information technology so that rural hospitals that don't have computers are able to buy them, and they're going to need some help. But on this issue of mandatory versus non-mandatory, not going around trying to avoid buying health care coverage. And in fact, if you look at auto insurance, in California, there's mandatory auto insurance. 25% of the folks don't have it. The reason is because they can't afford it. So John and I, we're not that different in this sense, that I'm committed to starting the process. Everybody who wants it can buy it, and it's affordable. If we have some gaps remaining, we will work on that. You take it from the opposite direction, but you're still going to have some folks who aren't insured under your plan, John, because some of them will simply not be able to afford to buy the coverage that they are offering.
Children cannot make that decision.
Well, and that's why I've got mandatory.
The decision he's talking about people making cannot be made by children, and that's why you have to require that they be covered.
John, I've got mandatory insurance for children.
Just 30 seconds.
For that, exactly that reason.
Hold on one second. I promised Congressman Kucinich. Go ahead.
I reject this whole approach, and the American people should know that with half the bankruptcies in the country connected to people not being able to pay their doctor bills or hospital bills, premiums, co-pays, and deductibles going so far through the roof, 46 million Americans, no health care, another 50 million underinsured, there is only one way to get health care coverage for all Americans, and that is to have a universal, single-payer, not-for-profit health care system, Medicare for all. Wolf, I've written the bill. It's H.R. 676 with John Conyers, supported by 14,000 physicians. And you know what? What Senator Clinton, Senator Edwards, Senator Obama are talking about? They're talking about letting the insurance companies stay in charge. They're talking about continuing a for-profit health care system. And I think we need a president who's ready to challenge that. And I'm ready to challenge the insurance companies.
All right, let's go to the next question, Tom.
Now let's try this now. This is my voice. Senator Clinton, you've said that it's time to allow gays and lesbians to serve openly in the U.S. military and in the don't ask, don't tell policy that was implemented when your husband was a president. Was President Clinton's policy of don't ask, don't tell a mistake?
It was a transition policy, and it was an effort to try to deal with the reality that probably since the very beginning of our nation, we've had gays serving in our military with distinction and honor on behalf of our country as we do today. And yet I have watched how Don't Ask, Don't Tell has been implemented, and I've concluded that it is not the best way for us as a nation to proceed. It has been, in many instances, implemented in a discriminatory manner. You know, after the first Gulf War, there was a big flood of discharges of gays and lesbians because they let them serve, and then after they finished the war, then they discharged them. In this particular time period, we've had Arabic linguists discharged under Don't Ask, Don't Tell when we are unfortunately so short of having people who speak the very language that our men and women in uniform have to understand in the streets of Baghdad. So I believe we could change the policy to let gays and lesbians serve in the military and be covered